Hello, how you doing, my friend?
I'm fine, thank you.
Thank you for taking the time out to
You're
help
very
me out with
welcome.
my global health project.
Okay.
Um, I just want to introduce you to the audience. This is Aina. He
Yes.
is a native from Nigeria, from Africa. He is now here in the States, and he is working in healthcare here in the United States. But he can give us he's willing to give us an overview of the healthcare system in Nigeria. So I know he's taking time out from his family and putting the children to bed. So I thank you for your time. If you're ready, my friend, we can start.
Yeah, I'm ready.
Okay. Again, what I was going to ask you was the question dealing with the citizenship of the Nigerians and their right to health care. Um,
Okay.
how do you view, from your own personal experience there and a family of the average citizen in Nigeria as far as their health care? What should they expect?
Actually, um, what I was expecting when I was in Nigeria was, to be treated like a citizen, not like a second class citizen. So it's like when you're sick, if your father is not well to do, hey, you just forget about living. Or if you don't know the right people, hey, you might as well just forget about you living on this earth because everything is like if you don't know nobody, you're gonna be on your own.
Yeah. It's very difficult, to be honest with you, to try to grasp that concept of being on your own and not having anything. Here in the States, we have access to healthcare, regardless if you have money or not. You can
Hmm.
always go to the emergency room. But in Nigeria, the hospitals are set up. Are all of them public, or are most of them private, or how does that work? And
Um,
can the average citizen just go to the hospital?
Actually, the hospital system is set up. You have a private sector and you have a sector. The public sector is owned by the government, and the private sector, as the name implies, is owned by the privates. I can in as well say the people that work in the public hospital owns the private sector. So whatever you need from the public hospital is always available at the private hospital because most of the people that work over there with the government, they owns their own personal business. So any medicine that you cannot get, that they will tell you that, oh, it's not available at the public hospital, they will make it available at the private ones, simply because it's who you know that you can get stuff from.
Right. So it goes back to who you know.
Yeah.
Um, as far as what if there was an accident? Let me ask you that. With all the upheaval and the civil unrest in that area, uh, can the average Nigerian, if the guy broke his leg or he's having, appendicitis or something to that effect, can they just go into the private hospital? Will they be turned around or
If you go into the private hospital, you better have your money in your hands. If not, you won't be treated. And
yeah,
the public hospital, you can go there, and somebody will be saying that, oh, well, before we let you in, we want to know what caused your amputation or what led to your illness
gotcha.
before they get you treated. And if you can explain, especially somebody that is in pain and that is very unconscious, how can that person give you what his status is? I mean, his status of health.
I got you.
That's not going to happen.
I
But
got you.
the person will be left to bleed to death. That's all.
So what role does the government play? I mean, I'm sure they collect their taxes of some sort. So what role do the government play in the health welfare of their people?
Well, the government is there. They give. It's like they allocate money to the hospitals like the way they do it in every budget all over the world. But are they making use of the money? No. Are the people getting access to the money? No. Are the people stealing the money? Yes, somebody is stealing the money because the money they're supposed to use for the people, somebody is pocketing the money. If there is any, in 2009, I went to Nigeria. My father went for a physical. So we went to that hospital, and as soon as I walked my daddy down to see the doctor, you know what? I'm talking about the public hospital because that lady gave my dad an hospital to come to gave my father an appointment to come to the hospital. And as we got there, the first thing they asked is um, his vitals was taken, everything was done, but afterwards they asked for money. And my father was ready anyway, so he gave them the money. And it takes forever for them to common blood work that we take for granted over here. It takes about 3 days for the blood work to return. I mean, for your test to come. You get the test done immediately, but it's gonna take another 3 days for you to get the results,
Right.
which is not right. Likewise, here you get within the most maybe 2 hours or 30 minutes you get your result. If nothing is wrong with you, they just let you go home. But they will let you go home with no test results.
Right. Those are substandards when they come to
Substandard,
for here in America. Let me ask you this question: alternative medicine.
Mm-hmm.
Since most people don't have the opportunity for a good healthcare provider as compared to here in the States,
Mm-hmm.
what are some of the measures that they use in their villages or in their homes to take care of their ailing?
Actually, they have some they call them herbalists, or sometimes they call them traditional doctor. That is, they practice traditional medicine. So in that case, if somebody is sick in the neighborhood, they'll just go and call the herbalist, and the person will just bring his or a concussion and give you the concussion before they take you to the hospital. Especially if, like, back in the 80s when my sister was sick, she just fainted, so they went to call that guy, and the guy came before the guy came. We've already took my sister to the hospital,
Right,
but she was treated at the hospital anyway.
right. Have you lost any loved ones that you can directly pin it on or blame on the healthcare system in Nigeria? Or do you know of anyone who you know died because they just didn't get the proper healthcare in that?
Mike, one incident happened about 3 weeks ago. My twin brother took his daughter to Nigeria just to go and study in there. So in course of staying there, the lady, the young girl, my niece, got sick, and he was taken to the hospital. So when they took him to the hospital, he was misdiagnosed. She was misdiagnosed, and in the course of that, she has a shortness of breath, and my brother has to fly from here to Nigeria to go and see his daughter. But thank God I mean, for the fact that the girl was born here. So they brought the lady here. Now the lady she's doing wonderful. She spent 2 weeks in the hospital here, and she felt better.
Gotcha.
So I didn't mean she was properly diagnosed, she'll be fine. But instead of treating the major cause of illness, they were treating malaria.
Right.
which was like part of their negligence over there. But you can't sue nobody
Right.
because you brought yourself to them.
Right. Right. Well, listen, I really do appreciate your time. Um, I didn't want to bring up any bad memories.
Oh, it's all right.
I'm
Oh.
sure you and your family are happy that you're here. But again, I just for the UNF University of North Florida community, I
Mhm.
just want to tell you thank you for your time.
Oh, you're very welcome, Mike.
All right. Have a good day. Thank you.
You too.